and I am delighted, we are delighted, to be joined today by Mia Seppo, Assistant Director General for Jobs and Social Protection at the International Labour Organization, and of course, right next to me, Ailan Lee, Assistant Director General for Universal Health Coverage and Healthier Populations Division at the WHO. Over to Mia to get us started.
Many thanks, Constanza, for the introduction and a very warm welcome to ILO. I'm thrilled to welcome Dr. Ailan Lee and your colleagues this morning, as well as all the participants from a range of partnerships and networks working across social protection, employment and health to discuss how to work better together to improve the health and well-being of the millions of people who rely on the informal economy for their livelihoods. I take this opportunity to thank the WHO for co-organizing this event with us in collaboration with the Sparks network. When I walked into a discussion between Dr. Lee and Shara, who is our director of Universal Social Protection, and they said, we all love social health determinants. So maybe that should be your hashtag for the day. That was a very positive beginning of the conversation. We are indeed thrilled to celebrate Universal Health Coverage Day, highlighting how employment, social protection, and other labor protection policies can contribute to making universal health coverage a reality and eventually improve health and well-being for all. The political declaration adopted at the UN General Assembly in 2023 recognizes the importance of social protection to achieve UHC for all people, particularly for those who are vulnerable. Workers in the informal economy and their families are often among the most vulnerable, even though this may not always be recognized. Today, we put them in the spotlight. The financial protection of individuals and households against healthcare costs, as well as their income insecurity, is a shared objective of universal health coverage and universal social protection. The dynamics of the informal economy play a role in current health and social protection coverage gaps through multiple channels. First, the lack of access to affordable quality healthcare services for those working in the informal economy underlines the necessity of a range of coordinated policies, including on employment and social protection, to address pervasive gaps in legal and effective recognition of people's right to social health protection, shortages in the health and care workforce, compounded by decent work deficits, often related to informality, and a limited reach of occupational health services to preserve health in the workplace. Second, informal jobs tend to be of low quality, with higher exposure to hazards and a lack of employment protection and access to social protection. As shown by our latest World Social Protection report, a report we're very proud of, so if you haven't looked at it, please get familiarized with the report. The human right to social security is not yet a universal reality, as half of the world's population, mostly from low and middle income countries, lack social protection. Those who rely on the informal economy for their survival tend to be disproportionately represented among those excluded from coverage. During periods of maternity, sickness, or disability, workers in the informal economy are exposed to financial hardships, which impacts both their ability to access healthcare services if universal health coverage policies are not in place, but also their capacity to adequately house and feed their families, with lasting impact on the health and well-being of the entire household. This situation underscores the urgency of addressing inequalities in the world of work and beyond. If we are serious about improving the health and well-being of those who rely on the informal economy for their livelihoods, we need to make social justice a priority and mobilize governments, social partners, and civil society towards this objective. No single policy or actor can do it alone. Examples of integrated action under the UN Global Accelerator on Jobs and Social Protection for Just Transitions, where 5 countries have already made commitments to improve access to health and care through integrated action from a range of line ministries must be replicated by others. As the world is facing multiple crises, integrated action is more needed than ever. Intersectoral policies are at the core of such action, and we have the responsibility as UN agencies to work together and provide integrated technical support to member states. Today, we would like to show the rationale for and impact of such integrated action. Discussions aim to illustrate that efforts in the world of work and social protection systems can be joined up to make a meaningful contribution to universal health coverage, especially for workers in the informal economy and their families. As the second Summit for Social Development provides an opportunity to gather the international community behind common objectives, the goal we set ourselves for today is to come out with a well-shaped narrative on the centrality of integrated intersectoral policies to advance social justice. I wish you an enriching day and fruitful exchanges, and I'm looking forward to hearing from the team of the outcomes of the discussion today. Thank you for listening.
Thank you so much for your inspiring words, Mia. Over to you, Dr. Lee.
Thank you very much, our dear moderator. Dear colleagues and friends, let me also start my expression on love. I think we all love universal health coverage, my dear WHO colleague, happy UHC Day. And we all love universal social protection. So the theme of this event is just amazing and the crucial, timely manner in my view, in particularly based on what we learned from COVID pandemic. It is really my great pleasure to welcome you all for this important meeting. I really would like to express my heartfelt appreciation to ADG Mia Seppo and our dear colleagues from ILO for hosting this important event in collaboration with WHO and the SPARCS Network on Tuberculosis. And I also would like to mention that my dear WHO colleague, many of them in this room, so I'm very grateful to my own WHO colleague. So ILO and the WHO share a long-standing tradition of collaboration, and today's seminar represents another excellent example of such collaboration. Last year, we came together to discuss prevention, preparedness, and the response to pandemic and epidemic in the context of COVID-19 pandemic. I was grateful here to be with you, dear ADG, for that event. Building on those collaborations, our two organizations will launch the publication on this topic later today. In fact, the pandemic gave us a lot of important lessons that we should take forward, in particular on how inequalities operate and influence health outcomes. As we discuss the connection between universal health coverage and the social protection system, I would like to take this opportunity to share 3 reflections, in particular from the WHO perspective. First, social protection plays such a crucial role in securing a healthy life. Social protection is more than just a safety net. It is a lifeline that secures fundamental conditions necessary for human health and well-being. The evidence is compelling. For example, sick leave benefits have been shown demonstrate to reduce all-cause mortality among workers, including heart diseases and injuries. Also, parental leave has been linked to the reduction in child mortality, as shown by many evidence over past decades. However, unfortunately, many countries still fall short of meeting our ILO standard of providing at least 14 weeks of parental leave. So second, strong social protection system improves social determinants of health. Very grateful to know the love social determinants. This is quite important, relative new. We need to make this learn and grow for the future. Comprehensive social protection system contribute to public health in multiple ways. They reduce financial barriers to care. By the way, financial barrier is one of universal health coverage elements. Improve access to preventive services and mitigate the long-term impact of illness on society and economic development. These benefits extend across all population groups, create long-term positive benefit for our society. For example, healthier population also means healthier workers, which in turn bolster productivities, innovation, and resilience in our societies. This is why prioritize prevention and promotion together with also healthcare is fundamental to achieving both universal health coverage and sustainable, effective social protection system. So my third point is addressing such complex multi-layer challenges in a complex world requires really multi-sector action and strong partnership. It's not new. We're talking about partnership, but we have to believe this partnership for co-benefit. That's the only way we do together, we can contribute our society. Health and social equity cannot be achieved by any sector alone. It requires collaborative effort across the sector. From my end, it's really encouraging our health sector, also working with non-health sector, in particular for the social determinant. For WHO, fostering such engagement between the sector or working cross-sector for the co-benefit is our strategical priority. I'm grateful to inform you that our member states already endorsed a new global health agenda we call the 14th General Program of Work, or GPW14. This new global health agenda places health equity at the center of our work, and emphasizing multi-sectoral action is a critical approach that we need to do more. In this context, I'm particularly pleased to highlight the growing collaboration between two agencies here. Very, very, very honored to have such a trusted working relation. For example, we look to delivering strong evidence-based contribution to the World Summit on Social Development next year, 2025. Super important. Additionally, with the launch of a World Report on Social Determinants next year, I'm sure it will come. And we look forward to partnering with ILO and partners to support countries in implementing its recommendation to strengthen universal health coverage and social protection. Dear colleagues, we have a lot to do. The world is not in the good place, but we all have a positive energy, believe our future. So together, we really wish everyone have a successful, productive meeting for our, if I may add, safer, healthier, more equitable, and more sustainable future for us, but more important for future generations. Thank you so much.
Dear Ailan and dear Mia, thank you so much for your rallying cries for collaboration and for leveraging synergies for health, equity, and social justice. Thank you for opening this event so well. And we thank you for your time and for your words, which will inspire the other speakers today, I am sure. So we can move on now to our next session, which will indeed be the launch of the first publication today, a WHO publication, which will show the results of our collaboration. Thank you so much.
Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you.
Good luck. So I'd like to welcome to the podium Maria van Kerkhove. We have Shara Razawi, and we have Sudhir Singh, who will be standing in for Director Etienne Krug, who unfortunately is taking sick leave today. So putting words into practice. joining us in the room, and I am sure online. We are now moving on to our first technical session, shall we say, of the day. It's going to be short, but very full of meaning and content. Oh, yes. We've Sala Atkins with us as well from Tampere University. So we are launching a WHO publication on the role of social protection in reducing the burden of public health and social measures during the COVID-19 pandemic. So let me quickly introduce our speakers who have joined us on the podium. So we have right next to me, Maria van Kerkhove, who is the ad interim director for Epidemic and Pandemic Preparedness and Prevention Department of WHO. We have our dear Shara Razavi, Director of Universal Social Protection at the ILO, and Sudhir Singh, who has very bravely stepped up to replace Etienne Krug, but he is certainly very well placed to speak in this session, and he is the head of the Equity and Health Unit in the Department of Social Determinants of Health, our beloved social determinants of health, at the WHO. Thank you so much. So, and of course, we have Sala Atkins, who is professor in public health at Tampere University, and who will kick the meeting off, who will kick the session off, because she is the author of the publication, and she will talk us through the rationale for the review, the results, of course, so the findings, and most importantly as well, the implications for policy and research. So, Sala, over to you.
Thank you very much for the opportunity to present to you this review on the role of social protection in reducing the burden of public health and social measures during the COVID-19 pandemic. Okay, which was a technical collaboration between the WHO, Tampere University in Finland, and the ILO. I hope you can see these. You may know that the public health and social measures are non-pharmaceutical interventions to reduce the risk and scale of infectious disease transmission, for example, hand washing, wearing masks, and so on. They operate by decreasing exposure to pathogens and making exposure safer, and they're sometimes the first and the only intervention available at an onset of an outbreak. They also require multi-sectoral and multi-level implementation. The benefits include, for example, reducing cases, reducing the burden on healthcare systems, enabling the continuation of business and essential service operations, and buy time to develop and produce vaccines and treatments. But they may also have unintended negative consequences, such as on health, such as on mental health, domestic violence, substance use, interrupted health service utilization, but also can have strong socioeconomic outcomes, such as increasing unemployment, interrupting learning, food insecurity, and poverty. Oh, yes, thank you. All right. So the examples of the COVID-19 pandemic that were negative health consequences were, for example, increases in malaria and tuberculosis incidence, a decline in childhood vaccinations. And it also had negative socioeconomic consequences, reversing 3 years of progress with poverty reduction, increasing food insecurity, children being affected by school closures, and a decrease in GDP per capita. Essentially, the pandemic impacted all the social determinants of health, and the public health and social measures sometimes compounded these impacts. Oopsie.
Apologies for the technical issues. We're working on it. Excellent. We're back.
Yes, this is good.
No, but the screen is small. Yeah.
That's fine. The people online can see it. No.
Yeah.
Yeah.
Okay.
Well, if you can make it better, that's great. But I think people online have a full view of Salah's slides. So Salah, apologies for this.
During health emergencies, social protection can have can have a large role. And as you already know, most of you, social protection is a set of policies and programs designed to reduce and prevent poverty, vulnerability, and social exclusion throughout the life cycle. During emergencies, it can reach those most in need, including those otherwise excluded from regular national social protection schemes. It can be used to provide adequate support, and it should be delivered in a timely manner. We already know from tuberculosis and HIV epidemics that it can have a positive impact on both health behavior and on reducing the negative impacts of the epidemics. However, prior to the COVID-19 pandemic, 50% of the work population had access to at least one social protection measure. But often the inadequacy of benefits and exclusion of vulnerable marginalized communities impacted on the delivery of these measures. During the pandemic, we saw a rapid scale up of existing benefits and introduction of emergency measures. So, together with the WHO and ILO, we conducted a scoping review on how social protection could be used to mitigate the unintended negative consequences of public health and social measures. We knew that social protection policy monitoring was available, but there was little known about the effectiveness of the measures specifically for health equity. We wanted to raise awareness for the importance of a multi-sectoral, equitable, and balanced implementation of public health and social measures to avoid unnecessary harm. And we also wanted to provide policy options and introduce the concept of social protection to health policymakers specifically. In our results, we identified from 316 papers over 1,079 social protection policies and programs. Of these, 523 were newly introduced and 272 were adapted for emergency needs. The most common measures that we found were in-cash measures, providing cash to individuals or households, particularly family maintenance interventions and child allowance. We also identified other cash measures. We also identified in-kind measures, where the most common measure used was providing food for families, 134 measures in total. But we also identified that across these 1,075 different measures, most of the publications and most of the interventions that we could find were from high and upper middle income countries, and with less evidence coming from lower and lower middle income countries, which is to be expected. In terms of then the effectiveness of these social protection measures, we found that there were positive effects of social assistance, social insurance, and other measures on food security across different country income levels. We found that 3 studies identified positive equity effects in these. We found that there were beneficial effects on social insurance, on financial and employment security, but there was a more mixed picture for other social protection measures. We found a few studies on dietary quality, but didn't find any effects for or against. In terms of social attitudes and cohesion, we had 2 studies which showed a positive trend for association between cash transfers and social cohesion, attitudes towards emergency response measures, and trust in government. And we found one study that suggested that there was a positive effect of repeated cash transfers in recipients investing in their children's education. More studies focused on mental and physical health, supporting a positive effect of social protection on mental and physical health, particularly in cash, in kind, social insurance, and interestingly, eviction moratoria. In terms of the qualitative evidence that gave a more nuanced picture of what the evidence was telling us, we saw that there were positive experiences that emphasized the usefulness of social protection as experienced by beneficiaries. It pointed to positive associations between social assistance and food and housing security, and it highlighted the power of social protection to help vulnerable and previously marginalized populations feel included. However, these studies also highlighted the challenges, emphasizing the complexity of providing social protection, including the need to address barriers for different groups, challenges in administering these interventions, particularly during emergencies, and challenges in identifying the most vulnerable populations. In implications then, as researchers, we have many issues and implications for conducting better research, including geographical coverage and research designs with comparators. I think implications in terms of the wider impact would be to promote multisectoral and multidisciplinary approaches, prioritize evidence for decision-making while acknowledging complexity and studying these kind of multisectoral interventions during emergencies. And whenever you're doing research or trying to collect evidence, applying an equity lens and disaggregating data to understand the data properly. In conclusion then, for policy and action, we would say that social protection should be integrated into health emergency preparedness and response. We should develop strong social systems outside of the emergencies to make them more efficient and resilient during emergencies. We need to note that effect of social protection is tied to the context, population, and implementation. And we need to evaluate emergency social protection measures to understand if the desired impact and reach is achieved. We can conclude that there are positive effects despite emergencies. We can conclude that there are adaptable systems that allow broadening coverage and increasing benefits, and there is potential for quick scale-up. And that social protection is beneficial to mitigate the unintended negative consequences from public health and social measures during health emergencies. Stronger systems are more resilient, and preparedness is key to responding to crises. If you would like to access the review, here's the link to the report and the QR code. Thank you.
Thank you so much, Stella, for outlining the research, the rationale, the findings, which provide a very robust base for evidence-based policymaking. So I'd now like to invite our panelists to discuss the findings with us. So let me start with you, Maria. So, of course, the COVID-19 pandemic has highlighted the importance of a multisectoral response, as we've heard Salah say, to health emergencies. Could we have your perspective and thoughts on the relevance of the findings of the review, and particularly on how they can inform future pandemic preparedness and response?
Thank you very much, and thanks to ILO for hosting us today. First of all, congratulations on the publication of the report. I know how much work goes into this, and the fact that this is an evidence-based review is really outstanding. So congratulations to everybody that was involved. This pandemic has been absolutely devastating it's touched every single one of us, every person, every family, every community, every country. And we saw immediately that we needed an all sectors, all of government, all of society approach. You know, the estimates that we have of the impact of not just the mortality of 7 million reported deaths, and it's probably at least 3 times higher, 1.6 billion children out of school at one point, 135 million more people pushed into poverty, 300 million people needing humanitarian assistance. The work that you've done here to look at social protection and reducing burden as it relates to public health and social measures is fundamental to the next stage of how and when we will need to use these again. It's absolutely clear that we will have more epidemics and pandemics as we go forward. In the beginning of COVID, we didn't have any evidence really related to the use of public health and social measures. So I'm very grateful for the work at WHO, and Ramona is here with me to actually look at how we can use PHSM to have the intended consequences of reducing transmission, but reduce the unintended consequences. So the evidence base that you have within this report is really helpful for us to be much more precise and having those intended consequences. I think in the beginning of COVID, just personally, I was in I was in China and for one of the early missions. And one of the things that we saw, communities come together to support health workers, where they were working 24 hours a day. They went and they provided groceries. They went and cleaned their home. They went and helped look after the children. And that level of support, which I think is just a small little example of how you looked at the cash and the in-kind and the support that you have for sick leave, just shows how much we need these social protections. So this is a huge step forward. This is really key in our work at WHO to be able to have this evidence-based guidance and working together with ILO. I'm very grateful for the partnership that we had during COVID and before, and will continue to have. And I think what you've identified here in the options within the report that can be scaled up and adapted, I think the key word is adaptation. So what we tried to do during COVID and what we will have to do during the next emergency is take a risk-based approach. It depends on the pathogen. It depends on the populations that are most at risk. It depends on the tolerance of communities and working with communities to implement, develop, and use PHSM, but also making sure that they have the social protection. So it's not one or the other. And I think, it's clear to this audience, but I think the way that you've been able to quantify and articulate this will really help us to be much more precise. So thank you very much for this work. I hope this spurs on more studies and actually we can advocate for more funding to have more studies to actually look deeper into this, taking these findings and pushing it to the next level. So congratulations.
Thank you very much, Maria. I think your message is loud and clear, and interesting to hear about a risk-based approach and how the roadmap towards introducing measures for any upcoming epidemics and pandemics will be clearer, I guess, based on our lessons. So thank you. Shara, moving to you. So talking about universal social protection. Now, can you tell us how the findings of the review speak to you and how they relate to the need for resilient and robust social protection systems?
Thank you, Constanza, for that question. And just to say how thrilled I am to be sharing this panel with Maria, with Salah, and with Sudhir. And it's also, I want to really thank all the colleagues who've been involved in the production of this piece of research, which we're all very proud of. I can see Nicole, my colleagues Lou and Natalie, who've been involved in the organization of this event and the research, and Christina Berendt, who is the director of our policy unit in the department. So a real and congratulations to everyone involved. And just getting to your question, Constanza, I think we are, the pandemic was obviously more than a wake-up call, but we are living in a world that is really sort of where we have entrenched inequalities and recurrent crises of different kinds. You know, we had the pandemic, we have climate crises that are erupting almost, monthly. We have news of the climate sort of catastrophes that befall countries, and the inequalities and the crises do reinforce each other. With every crisis, those inequalities often get, exacerbated. And in this context, to address these rising inequalities, which of course were very starkly, exposed during the COVID pandemic, as Maria was also saying, universal social protection is really, we see it as a very important and indispensable part of the response. Not only is it a human right, we have the human right to social security, but also we know that it can be very effective in protecting people against the routine life cycle risks that they face, the 9 life cycle risks that we talk about, but also against these covariate shocks of different kinds, whether they're climate related or whether it's a pandemic, which we understand from WHO, it's not a question of whether there will be another one, it's a question of when. So that, I think, preparedness is really key. But at the same time, our World Social Protection Report that was just launched in September of this year, which zooms in on the climate crisis, but also shows how the erosion of biodiversity also can, be a trigger for different kinds of pandemics. So the two things are really closely related. This report also shows with our latest data that despite the progress that we have made, still we have more than 3.5 billion people who have absolutely no social protection to fall back on of any kind, whether it's for their routine life cycle risks or whether it's in the context of these kind of big shocks that tend to happen. So a lot more needs to be done, clearly, just based on this data. And I think the scoping review that Salah was just giving us a summary of really highlights the potential of a strengthened social protection system in pandemic as part of this pandemic prevention, preparedness, and response strategies. And also the really important point of having, and this became very clear during COVID, but also during previous crises. The financial crisis of 2008 also made it clear. We cannot make systems on the run, on the move in the midst of a crisis. You need to have these systems already in place ex ante so that they can automatically kick into action, because otherwise it's really experimentation on the run, which is not the best way to go. This is a key policy lesson. So we really need to be building these systems and not wait for the next kind of big crisis. And I think that really does point us in the right direction. And I want to just end by saying that the scoping review also makes it very clear that we need to get the design of this system right. And here, I think we have an enormous amount of wisdom and vision in the international social security standards that we have. They provide really, it's not a straitjacket, but they highlight the principles that can really help in the design of a social protection system. And they highlight the importance of system building being done in a way that is rights-based, that provides universal coverage to everyone, regardless of the type of work they're doing, where in the labor market they are, or whether they're in or out of the labor market. So that universality is key. The comprehensiveness of the risks and the benefits that it includes, not only sickness benefits, but also family benefits, pensions, and so forth. The adequacy of the benefit levels, because the numbers we have on coverage are only looking at whether people are covered or not, but adequacy is important, as is predictability, and the way in which we finance these measures, and the fact that the key principle of solidarity in financing is absolutely key. So I want to end by just thanking our WHO colleagues for this opportunity to work together and to say that we have a lot more to do and a lot more research, hopefully, that will shed further light on the important work that is being done. Thank you.
Thank you very much, Shara. Again, for your important words, not only on design, but also the need to have systems in place, robust, comprehensive systems in place, so that they can then respond quickly to whatever shocks may happen. So, Sudhir, turning to you and moving on to social determinants of health. How would you say that a social determinants of health framing may foster synergies, greater synergies with sectors such as, for example, social protection? And how would you link this to the key takeaways from the scoping review?
Thanks so much. And it's wonderful to be here. Thanks to ILO for hosting us. And congratulations from me as well to all the colleagues who've worked so hard on this evidence review. I've seen firsthand how complex and interdisciplinary it is, and it's wonderful to be here launching it. So congratulations to the Tampere team. It's been a great partnership as well, working within WHO with our emergencies colleagues and Ramona and the colleagues there, and with ILO and Nicole coordinating from our side. So we're very excited. And on behalf of Etienne, he sends his regards. He read the evidence review and he's taking it seriously. He's not feeling well today, so he's staying home. But he also would like to echo that this is a real fundamental priority for us, this interface between social protection and health equity. Because, taking a step back, we know that the conditions in which people are born into, grow, work, live, and age, and the distribution of power, money, and resources in our societies, these are the biggest contributors to our health. These are the social determinants of health. And we're accumulating more and more evidence, more and more knowledge. The pandemic was a big wake-up call, which told the social determinants of health story so clearly, as we've heard already. And we're compiling this evidence in WHO's first global report on the social determinants of health equity in almost 20 years. And including the findings from this brief, contributing into that, social protection is one of the most fundamental and core objectives of this upcoming report. The report puts an emphasis on 4 interlocking strategies to achieve health equity. The first is to really put a focus on addressing economic inequality. We will not achieve health equity despite our best efforts within the health sector and within health services if we don't address economic inequality. And social protection, expanding social protection coverage, making social protection more comprehensive is fundamental to that. But so is actually countries having the fiscal space to do this. And Maria mentioned some of the ongoing consequences of the pandemic. But for example, the world's poorest 75 countries, over the last decade, the amount of interest that they have to pay on their debt repayments has quadrupled. And many countries are paying more now in debt repayments than on health, education, and social protection together. So that is not a recipe for health equity or flourishing society. So we need to address that head on. The report also really talks about the fundamental nature to tackle structural discrimination, to really take a considered approach to the determinants and impacts of health emergencies, of conflict, and obviously social protection from this brief we know is fundamental to that. We're also wrestling with some major transitions in our society, some major crises, but also opportunities. And we're trying to really harness the benefits of scaled up climate action, of digitalization. Digitalization, for example, can really revolutionize the way people can access health and social services in an integrated way. But it also can threaten that if we're not careful. And we know, for example, in the world of work, very fundamental to where we are today, digitalization is posing some threats and increasing informality in some vocations. And finally, we need better governance to bring all this together and to implement together. So maybe later on in the panel, we can talk about some of the concrete things we're doing. But we're very excited to be here, part of this brief, and now working with countries to take this forward.
Thank you very much, Sylvie, for adding these dimensions to the conversation. So I would like to bring your thoughts together in a final round of comments, quick fire comments. So I'm asking all 3 of you. Now, could you highlight 3 key action points from your respective sectors of work, as well as priority for collaboration based on what you heard this morning? Maria?
Yes, thank you. Yes, thank you. So yes, quickly. So we know and we need to systematically integrate social protection into the work that we do across prevention, preparedness, readiness, and response. This requires continuous commitment, and this is challenging at the moment because the fiscal space for all of this has shrunk. And the world does not want to talk about pandemics. They don't want to talk about epidemics. They've moved on. But governments have to take very difficult decisions to put into context all of the challenges that they face, whether it's climate, whether it's economy, whether it's humanitarian crisis, war, et cetera. But we know pandemic preparedness needs to be a constant. And we at WHO are trying to change this narrative of supporting this cycle of panic and neglect, which is rampant, even now. I can't even talk about COVID anymore, by the way, because the world wants to pretend it didn't happen or forget that it happened. But we need to use what we've gone through to actually drive us forward. So it's a continuous commitment to universal social protection and integrating this into the work. That's number 1. Second is to prepare for the expansion of social protection policies and programs during emergency situations. We know very well who are the most vulnerable in most situations, because this is systemic. This is, and to identify those who are most vulnerable, the individuals, the communities, anticipating these negative consequences will help us to better prepare. Using evidence-based reviews and evidence-based policies, guidance, data to develop guidance to support countries to set those policies. taking considerations, risk-based approach, et cetera. And third, to make sure that we have strong frameworks and partnerships in place ahead of the emergencies. So we work very well together, and we will continue to work well together. A lot of that is based on personalities and relationships. We need to make sure that that's rooted within our institutions and not based on only individuals, because that has to be sustained. And just to mention, this year, we have 77 elections. And a lot of what is challenged is happening in the political space. The work that we do, the preparedness that we have, transcends election cycles. So that relationship and those frameworks and those partnerships are really essential to make sure that it helps not only those of us here, but as Aylan Lee said, you know, those who come after us. So thanks for that.
Thank you for this wake-up call, Maria. Blimey, 77 elections. Talk about political will and needing to leverage that then. And of course, playing a wise counsel role, I guess, if people are in denial mode. So got our work cut out for us. So Sudhir, let me bring you in now. Your reflections, please.
Sure. I think very concretely, I'll cover 3 areas. First is on data. Dr. Aylan Lee spoke about the upcoming general program of work for WHO. And here we have really elevated addressing the root causes of health equity. But in terms of how you measure that, we're very pleased that the outcome indicator for that currently is SDG 1.3 on social protection coverage. So we'll be working very closely together. It's going to go to our member states for final clearance, but in terms of walking the talk here, we're really saying we can measure social protection coverage, and that's going to be fundamental to our work on healthier populations. We also have a new monitoring framework to actually, because most countries, even though I talked about these are the most fundamental determinants, most countries don't actually capture and measure this data nationally. So we've been pleased to publish with the ILO colleagues how to do this. And then that conversations really resonated. Just very briefly, for example, this year at the G20, Brazil was very much focused on addressing inequality, taking a social determinants approach. And we're very pleased, having worked with Maria's team and colleagues, to have seen that social protection as an indicator was then taken up in the G20's framework for looking at economic risks and vulnerabilities during health emergencies. So now we've successfully taken the social protection indicator and added it to that framework. So that's the data side. Then on the capacity building side, we think as countries really try to take a comprehensive approach to addressing health equity, we're trying to then encourage them to take an integrated approach between health and social services. And for example, it seems like a long time ago, it was just on Monday, we're very pleased to host a webinar with our network of the people leading intersectoral action on health with ILO. So your colleagues Lou is here presenting to our network of member states about the importance of social protection for health equity. So we're looking forward to continuing to roll out a capacity building program. And finally, on evidence and implementation, we're very fortunate to have a special initiative on the social determinants of health supported by the Swiss Development Agency. And here, 8 countries have committed to integrating health equity into their economic and social policy overall. And so we're now learning from these countries as they go about that journey of taking an integrated approach and sharing those lessons with other countries. And just to conclude with, I've talked about the World Report. To go deeper then on how we actually implement these recommendations, we'll be producing follow-up policy briefs. And we're very pleased that the first policy brief to provide further technical guidance will be a partnership between ourselves and ILO to go further and deeper on the health equity social protection interface. So a lot of work to do because there's a lot of demand to take this into action.
Thank you, Sudhir. I think you've given us very clear examples of how you're walking the talk, and also a very exciting pipeline with the report and policy briefs coming up. So Shara, you have the arduous task of closing this round of comments. Over to you.
Well, I think already a lot has been said, so I can only compliment. But I mean, I think if I had the 3 points as well, I would say, you know, we've seen that social protection system building and strengthening needs to be a core part of this preparedness, you know, for pandemics, for other crises. And I do want to pick up on the point that both Maria and Sudhir raised about this fiscal space constraints, because these are very real. I mean, it's not that countries haven't been waken up by COVID. Right. They know they need to strengthen their systems, but if they're paying, as you rightly said, in debt distress, so much more out in terms of interest payments and seeing their budget shrink, it becomes a really arduous task of trying to find those resources and create that fiscal space. So I think that's really important. And we also need to have some joined up messages vis-a-vis, you know, some of the big financial institutions, IMF included. We are living through a period of fiscal consolidation, as IMF talks about it. They do talk about needing to protect social expenditure, social spending, but we also have to make sure that this is not seen as a zero-sum game. Mm-hmm. So if we have more for social protection, then we need less on health or education. We really need to make the case that this is not how it works. We need to preserve and expand expenditure on all areas in order to have it as real social investment that can help our preparedness. The second point I would say is this need for the way we've done it. You've done it, you know, with this study of really having this kind of collaboration and operational sort of coordination between health and social protection sectors to really facilitate our understanding of also the constraints that different population groups face in terms of access. What kind of constraints are these? What are the barriers? And how can we make sure that these systems have integrated responses that really don't leave any groups behind? So this kind of, I think, collaborative work needs to go forward. And finally, I would say, you know, more research and monitoring on the impact of social protection on well-being and health of people. And in social protection, we look a lot at the impact on income security and income. And I think that lens needs to be broadened. And we really need to look at also health impacts and well-being impacts. And we've done some interesting work in the context of the Brazilian Global Alliance on Hunger and Poverty, looking at the impact of social protection on nutrition and food security. And I think that really, that kind of work needs to be expanded. So we have a much broader notion of well-being that includes income, but goes beyond income. And also research that's not limited to only sort of temporary cash transfers. We saw that from Salah's presentation and from this study that you know, we need to have a bit more evidence also on looking at the impact of social insurance programs and other types of social protection schemes on the issues that, you know, that we're focusing on. So that again needs to be expanded. And I want to really end by saying that this kind of collaboration, we have opportunities coming up. The Financing for Development conference in Seville, you know, there's a whole period leading up to that. And we were just in New York last week for the second PrepCom. We were very surprised to see the Elements paper made no reference to social protection. We now have a call to action, which is to, based on data that we have, to really call on countries to expand coverage of social protection by at least 2 percentage points per year. This is based on evidence that we have on countries that have done well over the past decade, and we think this is achievable, this is doable. And it would be great if WHO could also endorse our call to action, which has already been endorsed by the partnership USP 2030, so that we really make that push in the next 5 years that we have until 2030 to see the expansion and extension of social protection to more people, moving towards that universality of coverage. Thank you.
A great way to end. Thank you, Shara, with a rallying cry and a call to action and really channeling everybody's attention and work to leverage the political will required to make change happen. So thank you to our 3 wonderful panelists and discussants. Thank you to Salah Atkins for presenting the results of the scoping review. Thank you.
Thank you.